An Introduction to Competency-Based Medical Education and Competence by Design, the Faculty Perspective. Competency-based medical education, often referred to as CBME, is gaining momentum around the world as medical educators, physicians, and policymakers ask, what is the best way to ensure that our graduating specialists are prepared for the realities of practice within a complex and evolving healthcare system? This video is an introduction to competency-based medical education and competence by design and how these changes impact us and our trainees. Canada has a world-class medical education system and produces some of the world's best physicians, but it is rooted in a 100-year-old tradition that places significant emphasis on the amount of time a resident spends training in a particular rotation. With the modern pressures on our healthcare system, evidence tells us that training based primarily on time can leave gaps in a learner's competence. In a CBME system, the outcomes expected of a trainee are made explicit, and these outcomes are used to guide observation, feedback, coaching, and assessment. Curriculum is organized around these explicit expectations, and to advance in training, a resident must demonstrate achievement of the outlined expectations. The Royal College recognizes that time must continue to play an important role in medical education, and the intention is not to shorten or to lengthen residency training. Instead, the Royal College has developed a hybrid approach that emphasizes achieving and demonstrating competence within a specific training time frame. This small but significant change is designed to make a good system even better. So what is competence by design? Competence by Design, or CBD, is the Royal College's initiative to introduce CBME into specialty education in Canada. In addition to redesigning in-practice physician assessment and accreditation, CBD organizes residency training into stages and clearly lays out markers for teaching and learning at each stage. CBD uses more frequent observations for the purposes of providing quality feedback and coaching. It also allows us to identify struggling learners sooner and to take action to support them in a timely manner. To operationalize CBD, the Royal College has developed a competence continuum that breaks down residency into 4 distinct stages: transition to discipline, foundations of discipline, core of discipline, and transition to practice. In each stage, there are specific milestones and EPAs that our residents are expected to demonstrate. In order for residents to progress from one stage to another, they must demonstrate that they meet all the competencies expected in their discipline at that stage of competence. Let's take a closer look at milestones and EPAs. An entrustable professional activity, or EPA, is a key task of a discipline that an individual can be trusted to perform once sufficient competence has been demonstrated. Given that us and our residents perform these EPAs on a regular basis, it will be relatively easy to find opportunities to observe our residents, either directly or indirectly, and to give them feedback to support their learning and progress. Each EPA is made up of a number of milestones, which are based on CAMEDS 2015. The milestones are the abilities expected of a resident in order to perform the EPA at a stage of competence. EPAs are a clever and manageable way of doing a small number of observations that encompass a large number of milestones or abilities. We can think of an EPA as a basket or a funnel that holds a number of milestones. An EPA can be assessed globally as an entire task, or it can be unpacked into its component milestones to help inform feedback and coaching. But how will all this work? Specialties and subspecialties are starting to define specific EPAs and milestones for their discipline that are linked to the desired outcomes of training. The EPAs and their component milestones will be used to provide supervisors and residents with clear expectations of the skills and abilities needed at each stage of training. These expectations will help us plan teaching and coaching. To summarize, competency-based medical education is an approach that focuses on outcomes. Competence by Design is the college's initiative to introduce CBME into specialty education in Canada. The Competence Continuum is a series of distinct but successive stages that will operationalize CBD. EPAs are the key tasks of a discipline, which often include a series of component milestones. Milestones are the expected abilities of a physician at a stage of training. By clearly defining EPAs and milestones for each discipline, teachers and learners have a common understanding of the expected outcomes that can serve as the basis for coaching and feedback, which are integral to learning and assessment. But you may wonder, how does all of this impact us? As supervisors, we will observe a resident's progress on an EPA multiple times to help coach and teach and to record the resident's performance and improvements. By regularly observing residents perform an EPA, we'll be able to assess if they can be entrusted to perform the EPA going forward. Most of the time, we'll be doing many of the same things we do now, but we'll have more guidance so that we can do these things more efficiently and consistently across the country. With the shift to an outcomes-based approach, expectations will be explicit and they'll be based on key tasks of each discipline. We'll know exactly what to teach and assess. And it'll be much easier to detect when a resident is progressing faster or falling behind. And we'll also identify gaps in their learning and pinpoint where they need support. But how do residents progress from one stage of the continuum to the next? As residents progress, a competence committee will review all of the EPA observations that we make, along with other performance reports. When the competence committee has sufficient information, they will signal that the resident can be entrusted with the EPA. When a resident has been entrusted with all the EPAs at one stage of training, they're ready to move on to the next stage. Supervisors like us serve an important role in the teaching and assessment of residents now and in the new Competence by Design system. If you have any questions, please visit the Royal College website or email cbd@royalcollege.ca.